Hello, good morning. Today I will be demonstrating the breast self-examination. So what is breast self-examination, by the way? So this is a technique which allows an individual to examine his or her breast tissue for any visual or physical changes. It is often used as an early detection method for breast cancer. So both men and women should perform breast self-examination at least once a month beginning at the age of 18. So let's start the procedure by preparing the materials needed. So we'll be needing a mirror, a calendar, and a pen. Then explain the steps of the examination and its rationale. So there are two main components to the breast self-examination: the visual inspection and the palpation. So during the visual inspection, look for any discharges or scaling of the nipples, puckering, dimpling, or redness of the skin, and changes in the size and shape of the breast. While palpation is being done to evaluate the glandular tissues, the nipples, and the lymph nodes. So this is done in two steps. It is done in a lying down position and in standing or sitting position. There are three different ways or techniques or patterns in palpation. It could either be the circular pattern, the wedge pattern, or the vertical strip. And the levels of pressures vary from light pressure, medium pressure, and firm pressure. For the inspection of the breast, stand and face the mirrors with your arms relaxed on the sides, and then press your hands firmly on the hips, then turn side to side and note for the following changes. So check the breast for any changes in size, shape, color, retraction, dimpling, swelling, texture, or rashes, as well as the skin irritation. And then look for any changes in nipples, such as inverted nipples, and also look for discharges and symmetry. And then look for lumps and thickening of the breast. You can perform several maneuvers while standing in front of the mirror. So you can raise your arms over your head and then moving your arms slowly downward at the sides. So you can repeat up and down sides. And then press your hands together at the back of your hips and lean forward from your waist. Then note for any breast changes. For the palpation of the breast, assume a comfortable or proper position. So if you are in a back-lying position, place a pillow behind your shoulder and then put your left or right hand behind your head. And if you are in a standing or sitting position, while you are in an upright position, raise your right or left hand over your head, or you can put it at the back of your head. So you can perform the breast self-examination during the shower because the soapy hands glides more easily over the wet skin. But this is optional. In palpating the left breast, raise your left hand and use the pads of the three middle fingers of the right hand to palpate and feel for any lumps and thickened part of the breast. So press the breast tissue against the chest wall firmly enough to know how the breast feels. In the palpation of your right breast, it is just the same as the palpation of your left breast but in an opposite way. So raise your right hand and then use the pads of your three middle fingers with your left hand and feel for any lumps or thickened tissue of the breast. So you have to take note if you feel a rigid, firm tissue in the lower curve of each breast, that is normal. Palpate one breast at a time using one of the three different patterns or techniques. So in circular pattern, palpate in a clockwise direction following imaginary concentric circles from outer limits of the breast toward the nipple. So in wedge pattern, palpate each number in the face of the clock toward the nipple in a clockwise fashion. And in vertical strip, palpate following an imaginary vertical lines on the breast is starting on the outer upper quadrant or inner upper quadrant. Be sure to palpate every square inch of the breast. Use a small circular motion systematically all the way around the breast as many times as necessary until the breast is covered. So be sure to palpate the tail of specs. So you have to vary the levels of pressures during palpation. So light pressure is used for superficial tissues, and medium pressure is used for mid-level tissues, and firm pressure is being used in deep to the ribs tissues. So for big breasts, lift one breast with one hand, then palpate with the other hand or using the finger pads every square inch of the breast. Palpation of the nipples. Alternately squeeze the nipples gently with the thumb and index finger and note for any discharges. And then palpation of the axilla or associated lymph nodes of the breast. You have to palpate one at a time. So bring one arm down to the side and feel the armpit where the breast tissue is also located. So palpate the lymph nodes, the supraclavicular, the infraclavicular, the central or mid-axillary lymph node, and the lateral or the brachial lymph node. Then finally, document the results of the breast self-examination for each breast. Then mark your calendar for the next month of your breast self-examination. That's all. Thank you and goodbye.